I'd like to thank you for selecting this particular course to take today. Hopefully this will be something that will be immediately something that can be applied in your clinical practice and in your day-to-day treatment planning. We're going to take a look at crown lengthening today, and it's a procedure that almost everybody in day-to-day practice is familiar with, but hopefully what we're going to do is we're going to explore some of the nuances of crown lengthening, exactly what it can do for your patient, what it can do for your practice, and a way to actually improve, hopefully, your restorative dentistry outcomes long term. I'm President of the Associate Dean of Postdoctoral Programs and Professor of Clinical Dentistry at Columbia School of Dental Medicine. So let's look at our goals and objectives for today. First, we want to be able to evaluate proper tooth preparation. So that although you've been preparing teeth for years, in certain key areas we want to look at some, once again, little nuances in tooth preparation that are fairly important and actually play a role with the outcome of crown lengthening. Two, you want to understand the importance of biologic width, but not the old school term of exactly the dimensions and everything, but we want to look at it from maintaining crown margin stability. The margin of that soft tissue staying where it was the day you inserted that crown. We also want to evaluate different biotissue types and how this is going to actually relate then to the long-term outcomes of the prosthesis. We also want to understand the wound healing process after surgery, and this is important in timing of when you can move from your temporary phase into your final permanent restoration. We also want to evaluate tooth size and tooth shape, and all of you do this because this is quite important in your cosmetic part of your day-to-day clinical practice. We also then want to actually look at the role of quality temporaries and how this actually goes hand in hand with the actual crown lengthening procedure and the final outcome and the gingival margin stability as it relates to your permanent restoration. How am I going to go about controlling this inflammation? So it may be everything from increasing the frequency of recare and recalls for the patient from twice a year or once a year to every 3 or 4 months. It may be introduction of other oral hygiene implements that prior did not use. You may be actually forced to take 4 or 5 millimeters away to allow for a ferrule effect around teeth, post, and core. So this way that the whole shoulder and the whole margin is placed on tooth structure, sound tooth structure, and not placed anywhere onto the post and core. Now, we're going to segue briefly into aesthetic tissue alterations. And a large area now for many of our practices is providing veneers, laminates, porcelain crowns, and improving the patient's aesthetic outcomes. You did crown lengthen the teeth when they were required. You waited the appropriate healing period of time. You had great temporization, and you provided the patient with a great dental service. Thank you.